Hello everyone, welcome to my Evaluating Advocacy video presentation. My name is Jasmine Stanley and this is for the SWK 601 Social Work Advocacy course. My professor is Professor Kaylee Archery. Today is April 22nd, 2026. Please enjoy. So, what is an immigrant? An immigrant is defined as a person who resides in a country other than the one in which they were born. People migrate for a variety of reasons, right? Including the pursuit of a better economic condition, improved job opportunities, educational advancement, and access to more stable living environments. For many, migration is also a necessary response to violence, political instability, persecution, and the lack of safety in their home countries. Immigrants have many different cultural aspects. Okay, so immigrant populations are culturally diverse, encompassing a wide range of language traditions, different traditions, religious practices, family structures, and values. Strong family ties, collectivism, respect for elders, and cultural traditions often play a central role in immigrant communities. Common barriers that immigrants face include language barriers, limited access to cultural competence in healthcare and mental health services, legal insecurities, discrimination, and economic instability again. Navigating these unfamiliar systems, such as healthcare, education, legal processes, these all of these things further impacts their well-being. While the fear of immigration enforcement also discourages many immigrants from seeking services even when they're eligible. And that is quoted from the CDC. However, I know that we're talking about the barriers for immigrants, but they are also very resilient, right? So key factors that contribute to this resiliency includes strong family and community networks, mutual aid systems, cultural identity, and a shared sense of perseverance. Cultural traditions, faith, and community based organizations help to provide emotional support and a sense of belonging, helping individuals cope with ongoing adversity. So, these individuals, although they are immigrants, although they have come from their own country seeking better conditions, they are very resilient. Cultural traditions really play a main role as well as faith. That is a key factor for the coping with adversity. So let's talk a little bit about the marginalization of immigrants. So let's go from past to present, okay? So U.S. immigration was largely unrestricted until the late 1800s. The Page Act of 1875 and Chinese Exclusion Act of 1882 introduced racially discriminatory immigration laws. Although the Immigration and National Act of 1965 ended in racial quotas, marginalizations continued throughout enforcement practices. Today, immigration remains highly politicized, with increased detention and deportation creating a fear of instability. And let me just interject here, as we all notice and as we've all seen, ICE has become an increasingly fearful agency for many immigrants just because of their practices, their policies, and their laws. Okay, so some states and cities adopt sanctuary and inclusion policies, while others restrict access, resulting in unequal protections. And that's what we're facing and what we're seeing now with the ICE organization. Ongoing advocacy challenges discrimination, and this promotes immigration rights and inclusion. Okay, so let me say that again. ongoing advocacy challenges discrimination and promotes immigration rights and inclusion. So that is why we as social workers have to advocate against these unjust procedures and policies. So social well-being impacts immigrants and their well-being. So at the federal level, Immigration and Nationality Act, which is also known as INA, governs immigration status, admission, deportations, and eligibility for protections, directly impacting the family stability and access to the services. Okay, deferred action for childhood arrivals, that's called DACA, DACA, provides temporary protection and work authorizations for eligible undocumented youth, supporting education and employment stability, which is really great. So I live in Wisconsin, and in the state level, in the Wisconsin state level, policies include driver's license access proposals, DLAP. These policies allow licenses regardless of the immigration status, which increase mobility, employment access, and public safety. Additionally, state funded legal aid initiatives have really pushed and really helped these barriers. This act expands access to immigration related civil legal services, reducing deportation risk and family disruption. Social policies continue. So let's look at the local level of policies. Here in Wisconsin, there is a sanctuary policy which limits cooperation with federal immigration enforcement, increasing trust in local institutions and access to services. One of the things that we noticed, or that I noticed during this research, is that a lot of immigrants have a mistrust with law enforcement, with political figures. And so this sanctuary policy really helps to aid them in trusting local institutions. Also, there is a safe haven policy. That policy protects access to schools, healthcare facilities, and community spaces without fear of enforcement actions. So that's a really great one too, and that is from the CDC. So let's look at the advocacy plan. The advocacy plan that I came up with focuses on community advocacy to address the barriers that we talked about immigrants facing in accessing affordable and culturally responsive healthcare. The goal of this plan is to improve access to equitable healthcare by strength and community-based efforts. The advocacy plan, so when we look at it, short-term outcomes focuses on improved communication and awareness of resources. So what we found is that many immigrants don't know what resources are available to them. So a part of the advocacy plan is to really get those resources out there and to provide awareness to them. Our medium-term outcome looks like emphasizing consistent engagement with services and community supports. As a current case manager, one of the supports that we work with here in Wisconsin is called CSP, which is the Community Support Programs. You will refer the client to this program. Someone would go out, they would be assigned a case manager or a social worker. Someone would go out, work with them, help provide medication management, get them resources, access to health care, things of that nature. So we think that community supports is very, very important, and it's actually an essential medium term outcome. A long term outcome that we looked at is to aim to enhance overall health, stability, and community integration for our immigrant members. Now, when we look at this, we have to remember that these individuals have come from other countries. Um, and sometimes it's difficult to integrate when you're from a different country and you have to learn the practices, you have to learn the laws. So, really enhancing that overall health and stability would be beneficial, as well as promoting community integration. Key strategies would look like coordinating interpreter services. Because again, we identified that language is a barrier, right? So, coordinating interpreter services, connecting members to community resources, providing accurate immigration related information. Sometimes information comes from family or friends or, others. However, accurate information is going to be best practice in these cases. Um, and then we want to provide accurate immigration information within a professional scope. So we don't want them to just receive information from just anyone. We want it to be within a professional scope. And ensuring that access to culturally informed medical and mental health providers is very important. Here in Wisconsin, again, we have community partners such as ADRC, Lutheran Social Services, Wisconsin DHS programs, and other immigration service providers. So, really connecting our immigrant members with accurate services, beneficial services, emphasizing that consistent engagement is going to be a great support. So, when we think about social media is an amazing way to get out information. Immigrant families often face barriers that prevent them from getting the care they need, from language challenges to fear and misinformation. Together, we can change that. Hashtag immigrant health, hashtag know your rights, hashtag advocacy. This social media campaign that I just spoke of, let's go to it a little bit. Everyone deserves access to quality health care, yet many immigrant families continue to face barriers again, such as language challenges, fear, and limited information about available services. However, by raising awareness and sharing accurate, empowering resources and education, we can help ensure that immigrant communities receive the care and support that they deserve. Additionally, we will provide real people, real experiences, and real stories. This campaign encourages community members to learn about healthcare rights, uplift immigrant voices, and advocate for equitable access across the services. So today we can take action by sharing this message on social media, Facebook, Instagram, YouTube, Pinterest, and Snapchat. LinkedIn is also a very professional and great networking application to provide and to share this social media campaign. We want to ensure that we are sharing this message so that individuals in the community could attend our upcoming community workshops, contact local representatives, and clinics that serve immigrant families. Together, we can work toward a healthier and more inclusive future. Our survey and administration plan. So I created a survey um, just to gauge what the needs were for our immigrant community. The survey will be made available in multiple languages. As we already discussed, there are many language barriers. This is for individuals who speak a different language or comprehend differently. So we want to make sure it's accessible to all. This survey will be available both paper and electronic formats, which will be used to accommodate varying levels of technology, access, and digital literacy. Distribution will occur in collaboration with trusted community partners. So we want to make sure that we're abiding by HIPAA and informed consent. Okay, so distribution would occur in collaboration with trusted community partners, including community-based organizations, faith groups that looks like churches, mosques, and any other faith group, and service providers to foster trust and participation. That is one of the greatest things that we want to foster here. We want trust with our members, regardless of their status, and we want participation. Participants will be informed of the survey's purpose, confidentiality safeguards, and their right to decline or discontinue participation at any time. So after providing and getting the survey completed, here are some of the commonly reported challenges, okay? These included, again, language barriers, number one, healthcare access, employment barriers, housing, legal documentation, and cultural adjustment, indicating multiple overlapping needs. Access to healthcare was frequently rated as poor to average, suggesting that barriers related to affordability, language access, and system navigation still need some work. Um, Employment satisfaction varied, highlighting a need for job placement services and workforce support, especially for individuals with limited credential recognition. So, remember before when I talked about what an immigrant was and some of the barriers that they face? Because people are coming from their country to a new country, educational standards are different. So, we want to make sure that they are provided with information and awareness as it pertains to credentialing. Additionally, participants identified a strong demand for language classes, legal aid, healthcare assistance, and social integration programs. When we look at evaluating advocacy, in alignment with Halford 2019, which is our textbook, the advocacy practice framework, the advocacy plan would be evaluated using both process evaluation and outcome evaluation to determine effectiveness and guide continuous improvement practices. Process evaluation would track outreach efforts, partnership, survey distribution, and referrals. Outcome evaluation would examine short term awareness, medium term engagement with services, and long term improvements in accessibility. And let me just interject again here. We want to make sure that whatever plans and whatever interventions that we put in place for advocacy, we want to ensure that it yields long term success. But we cannot get long term success without ensuring that short term goals, medium term goals are put in practice, especially because there's such a culture shock, there's such an educational shock here in America. So we want to make sure that we're implementing small goals to get to our long term goal, which is uh, improvements in access and stability. Lessons learned included the importance of trust building. I think it's important for we as Americans to ensure. I think it's a duty for us and to ensure and to motivate others, educate others, and motivate others around us to embrace immigrants. Sometimes they are identified as aliens and like all the verbiage that I'm not fully okay with, and I know that they're not. Sometimes those words can be very much derogatory, and it could cause a lack of trust within our community. So I think it's very important for us to be educated as a people when it comes to others. Um, I always use this analogy. We want to treat the janitor the same way that we would treat the CEO. And in this case, it's no different. As social workers, we're called to advocate for the marginalized, the oppressed, those without a voice. And in this case, this community, these members of our community really need the advocacy. Okay. So, again, lessons learned included the importance of trust building, flexibility, as well as community partnerships. I strongly believe that we cannot do anything on our own. So, collaboration will be very important. We want to collaborate with mental health professionals, we want to collaborate with educational professors and teachers, those that can provide, even basic level English verbiage. So yes, community partnerships is very, very important. We want to advocate. We want to go down and lobby if we don't understand policies. We want to create written policies. We want to go to legislative levels to ensure that our community, whether they are immigrants or documented citizens, have exactly what they need to flourish. Okay, so again, key barriers really included that language access. That's a big piece of this. Fear of enforcement. We want to make sure everyone feels inclusive and aware. Sometimes people are fearful because they don't understand. Sometimes people are fearful because they're not educated on the laws. Sometimes people are fearful because of what they've heard from others. So we want to make sure that we're really educating each other, from the social worker down to the immigrant, right? Additionally, another barrier, mistrust of systems, um, small sample sizes. So, when handing out these surveys, we want to make sure, we want to ensure that everyone is included. Everyone is included. Everyone understands what an immigrant is. Everyone understands what the survey is asking. So we want to make sure that there's enough to get around. And the last barrier that we were able to identify was limited technology access. So again, I know that I brought up the social work, I'm sorry, the social media campaign, but everyone doesn't have access to digital platforms. I know that we live in a time where everyone has a cell phone, but if we're being honest, everyone doesn't know how to use a cell phone. Some people are limited to technology. So we want to make sure that everyone, no matter who they are, has been educated properly and accurately. Thank you so much. I really hope that you all enjoyed this presentation. I hope that it was informative for you. And have an amazing day. My references are listed next. Thank you so much.